I just want to come and bring y'all some information about a topic that I think is like super important that we do not talk about enough, which is mental health. We usually spend a lot of time focusing on physical health, which is kind of exercising and eating right, but nobody really talks about mental health. And I think a lot of that is because there's just a lot of miseducation about mental health. But in my opinion, mental health is kind of significantly more important than physical health, because without mental health, you can't really get to the physical part. Like, mental health is like your everything. That's your ability to like comprehend and function. So if you don't have that, kind of everything else will fall apart in your life if you're not taking care of your mental health. So a part of that, like I said, is miseducation and just the perceptions and the stereotypes around mental health. And let's just go ahead and address some of those. Like, mental health does not mean that you are crazy and you're in a straitjacket. It literally, that's kind of the extreme situations. Like, mental health can be PTSD, which is post-traumatic stress disorder. It could be being bipolar. It could be depression. It could be anxiety. And these are things that a lot of people have issues with, and nothing ever happens with it because they're unaware that they have it, or there's just all these stereotypes and just kind of miseducation around it. So, and also mental health doesn't mean that, like I said, you're crazy or weak or something's wrong with you. Part of that is when you have some of these, more common mental health issues that I named in my previous video, is a lot of times the symptoms of having those conditions is you start to self-medicate. And literally self-medication could look like alcohol and drinking all the time. It could be literally just smoking cigarettes. It could be smoking marijuana. It could be just the type of relationships that you have with food, or just the type of, relationships you are in with people, or it could be, sex addiction. It could be being obsessed with your career. There's just so many different ways that people self-medicate. And, you kind of think that it's normal, which those things that I'm talking about, there's nothing wrong with any of them. It's just when you have an obsession with them. It's when you have to turn up every single night to be okay with your life. It's when you have to stay high to be happy with what's going on in your life. Those are symptoms of a deeper underlying issue, like mentally. And a lot of those stem from, maybe there's some hurt you're currently going through in your life that you're having trouble dealing with, or you don't want to deal with. So you do all those things to, deal with the pain. Or it could be something in your past that you haven't dealt with or taken care of. And so it manifests itself in all these different self-medication actions that you're taking. And so it's just important to understand why you do what you do. I think that's a big part of addressing mental health issues and, kind of stopping the stigma around it. Because a lot of these things we all do, because life is hard, life is a struggle. And so trying to self-medicate, there is not enough alcohol, there's not enough marijuana, there's not enough sex, there's not enough people that can heal you from these issues. A lot of times these issues take getting professional help. And there's stigma around that too. Like, oh, I don't want to be weak. I don't want to be telling people my business. And it's like, no, you need to do what you need to do to be all that God's created you to be and all He's created you to do. When I talk about getting professional help, that can look like a lot of different things. That could be seeing a therapist and having counseling sessions. That could literally meeting with your primary care provider, like your doctor, and seeing what recommendations they have. And so those are just different options for professional help, because honestly, venting to your spouse or to your friends, a lot of times that's not enough to heal you and get the help you need. And so what you have to understand is I don't give advice to people that I don't take. And so I've been there. I've done these things. Like early on in my marriage, me and David did get marriage counseling because it wasn't working and it was beyond the stuff that we were doing or knew how to do. And so we needed to get professional help. And we'll be celebrating 5 years of marriage in July. So that's God, and then that's marriage counseling that got us to that place. As well as some mental health issues, like some anxiety and depression problems. You need medication to basically help your emotions and your body to get the chemicals correct, because they've somewhere, somehow, throughout the things that have happened in your life, got imbalanced. And so if you don't get help and, see a doctor and get those medications, it does lead to, committing suicide. It does lead to overdosing. It does lead to all these different things. And I'm not saying that everybody who has ever committed suicide or overdosed is because it was a mental health issue. No, I'm just saying these are some of the symptoms of not addressing your mental health and getting those things taken care of. And off of what I was talking about earlier with anxiety and depression, because certain levels of anxiety and depression do require medication just to chemically get your brain and your different hormones back in balance. And that's actually something I struggle with and have dealt with is, I'm considered to have mild anxiety and depression. And if you've been following my life the past couple of months, you could definitely tell why I'm actually surprised that it's not like extreme like anxiety or depression, everything I've been dealing with. But I say that to say it is a chemical thing where you need like medication, or there's certain types of diets that you have to abide by to basically get your hormones back in balance. And it's important that you do that, or things can get really bad. And so another part of that is, literally you just have to be willing to, I guess, put your pride aside and get the help you need to be living your best life. And I think a lot of us just have to stop caring what people think as well. That's another issue that people deal with and don't get the help they need because they don't want so-and-so to be thinking this or that about them. And so I just want to be here to tell you, like, mental health is important. Get the help you need. Like, don't try to self-medicate out here and cause more harm to your body physically because you're, uneducated or are scared to take the steps that you need to get the help you need. And like I said, in terms of counseling, you literally can check with your insurance company. And a lot of them provide that. It's included in your insurance package. And a lot of times it's under behavioral health. Call them, ask questions. Also, you could check with your primary care provider and ask them questions about it. They might have referrals or recommendations that they have. And just in general, if you need help, there's a lot of places, if you don't even have insurance, that work on sliding scales and will provide counseling services for you. So this is for your marriage. This is for you as an individual, to get the help you need. If you saw some traumatic stuff in your life, whether it's the death of a loved one, whether it's just in general, life is happening to you right now and it's hard, get the help you need. Don't wait till it's too late. Like, get help. I recommend it. And if you need help, I'm a health educator and health specialist, and that is my job every day when I go to work, is to help people get the resources they need to do what they want to do in their life. So don't be out here looking crazy or struggling by yourself, because you're not alone and there are resources out there. And I want to help you if nobody else wants to help you.